The sun, the environment, our heredity, even our hormones can affect our skin and make us look older. But at Wilmington Dermatology Center, there are ways to reverse that process and make us look younger. Today on Your Hometown, we're at Wilmington Dermatology Center. I'm Randy Aldridge. I'm here with Dr. Rosalind George with the Wilmington Dermatology Center. Thanks so much for having us today.
Yeah, thank you.
So aging is something all of us think about. Tell me
Yes.
some things that you look for when it's time to make those steps and start making some procedures to make yourself look younger.
It's not so much what I look for, it's what's bothering that person in the mirror. So people will come to me and say, I'm starting to look like my mother or my father, or I'm starting to notice this spot or this wrinkle. So we really look at all sorts of things that's bothersome to the patient and address those things for them.
And we all get to that moment, don't we?
Yeah.
All right, well, let's take a look at some
Absolutely.
of the things you can do to do that.
Okay,
Fix this up.
perfect.
Thank you.
Randy, let me show you one of the devices that we offer and tell you what it does.
And this is for?
This is Ulthera,
Okay.
and this is for skin tightening. So one of the things people will frequently say is skin sagging. They feel like their skin is sagging.
Not looking fresh anymore.
Yeah, just not looking fresh, and they notice they're starting to get those dreaded jowls. I don't even like to say the word, it's kind of a bad
All the
word.
stuff
Jowls,
right
another
here.
four-letter
Yes.
word in this office. And so what this does is actually uses ultrasound. So the same ultrasound that you're looking at a baby with in a mother's tummy. Except it's the same idea as, did you ever use a magnifying glass to put a hole in a piece of paper on a hot summer day?
Yeah.
The
Yeah,
idea
yeah,
is
yeah.
we're focusing energy at deeper structure levels. So part of what happens with the aging face is that your structure starts to just crumble a little bit. Your collagen weakens, and what we're trying to do is trying to get it back in order. So
Okay.
trying to strengthen it up, kind of like ripping up a muscle and building it back up in the gym so that your muscle builds.
Okay, Dr. George, when you say burning a hole in a piece of paper, it sounds painful. Is this something that's, tell me about the pain and
You know,
recovery and
of
those
course
kinds
we
of
always
things.
say no pain, no gain,
Right,
right? But really, it's not terribly uncomfortable. We make it very comfortable because we numb the skin. So
Okay.
when you come in, we mark the skin. I would look at you and go, okay, we're going to treat here and here, and I
Right.
put the markings on.
Right.
And then we actually inject a little numbing medicine so you don't feel.
So just one little injection, and then
Yeah.
you come out looking for and feeling fresher.
Yeah.
So exactly how does this work? What do we use here?
So this is the little ultrasound transducer.
Okay.
You can see that we just turn it on. It kind of gives me, it's going to give me an image up there, so then I can see exactly where I want to be, make sure I'm not treating over any structure, make sure I'm not over a bone.
Okay.
And then literally, I move this little millimeters down, so I would go, okay, I'm going to treat you on your face, and I press the button and I move up. Each treatment takes about an hour, hour and a half.
So when you do something like this, how soon do you see the results?
Because we're working at a structural level, it takes a little bit of time, 3 to 6 months to see the best results.
All right.
So it's not instantaneous.
Okay. And this is Ulthera.
This is called Ulthera.
All right. And what is this?
So this is another device that we're really excited about. This is called Clear and Brilliant. I'm just going to turn this up so you
Alrighty.
don't have to hear that. So this is called Clear and Brilliant. And Clear and Brilliant is great because we live in a beach town and everybody is busy and we have a lot of sun exposure and people don't want the downtime of chemical peels and lasers.
And so many people here have that sun issue.
Yeah.
They've been in the sun their whole
Yeah.
lives and they hit it all summer long.
A lot of people will get that melasma or the mask of pregnancy where they get the brown splotches
Right,
on their face,
right.
and it's really bothersome to people.
Yeah.
And there just isn't a lot that can treat that. And this is really nice because it's a treatment. You can see it has this little roller ball on it, and so I can treat somebody's face. It's a little bit uncomfortable, a little prickly heat sensation typically.
Right.
We put a numbing cream on for about 30 minutes so it's more comfortable for people. And literally somebody will just be pink for about 24 hours and then they don't look like they had anything done.
And how many of these treatments does it take before you start seeing
3 to
results?
6 of these. Now your skin will look better after one, but it's not transformative. There are other things we can do to transform the skin. We think of this as more as a maintenance treatment,
Right.
kind of like getting your car's oil changed.
Right. And this is one of those things you can do and really the next
Anytime.
day maybe back at work.
You'd be fine.
Okay.
I've had multiple of them done. It's very popular among younger clients in their 30s that are just, hey, maybe not ready to do anything major, but want something to refresh their skin.
Right.
And they can literally have it done and the next day go and have a social engagement.
Is it better when you're that age to go ahead and start thinking about these kinds of procedures?
I do, I think so. I mean, what we know is, if you're gonna wait until you have a deep line and lots of sun damage, and then you're gonna end up spending more money, you're gonna
Right.
having more procedures done, and the results aren't gonna be as good. I said there's kind of a sweet spot when you wanna start thinking about these, 30s, you wanna really start thinking about good skincare,
Yeah.
thinking about, facials and minor chemical peels and something like Clear and Brilliant. And then as you get into the 40s, you want to start thinking more about some of the more transformative things like the Ulthera and what we're going to talk about next.
Let's go
the
talk
Fraxel.
about this one. This one's
Yes.
a big machine.
This
Let's
is
hear
a big
what this
machine.
one
Yeah,
does.
it's not as pretty as the
I
other
know.
ones. But this, I don't know how I live without it, to tell you the truth.
Okay, tell me about this one.
This one's really nice Yes, it actually is 2 lasers in one.
Okay,
And what
the word laser sounds scary.
The word laser sounds scary, but it's really exciting because lasers more do surface change.
Okay.
So they're working on fine wrinkles, brown spots. People hate the little smoker's lines around their mouth, the little crow's feet that people get around their eyes. And so this is more of a transformative laser.
So would this be an alternative to a surgery?
Well, most of these things are all non-invasive. If you need surgery, you need surgery, but we know that when you start before you need surgery, you can kind of prevent having to go under the knife. And that's really the trend, is that, you know, people would go and get a facelift and they'd be all pulled tight, and that's not the look that people are going for.
Right.
And that's not what's happening with the aging face. That's not what we know. If you just pull it tight, people don't necessarily look younger.
Yeah.
People lose volume in their face, so you have fat pads that sit all over, and as we age, they literally just start to conglomerate. You get like a fat pad here, one under your eye,
Right.
and you start to lose volume through here. People start to look gaunt or hollow.
Yeah.
You also lose bone as you age. So your bone literally starts to lose bone in your face just like you do in your hip bone and
Right.
shoulder bone.
So how does this work?
This more is for kind of surface change. So that's the collagen loss that we experience. So we talked about kind of the deep structural loss with the Ulthera.
Right.
This is more of the stuff that's happening on the surface.
Right.
So what this does is there are 2 different wavelengths. The first laser in this with the wavelength will do all the brown spots. So this is kind of like the clear and brilliant. One treatment, yeah, 1 treatment, 1 to 4 treatments to get the maximal results. And it depends on what you're targeting. If you're looking to do a lot of wrinkles, you need 4. If it's really brown spots and just a refresher, you're going to see great results with 1. So it just depends on what you're looking for.
Okay.
But very similar to the clear and brilliant with the roller tip, and you literally, we just roll it across the skin like this.
So no pain, really?
Well, no, it's not on.
The light through me.
Yeah, the light through you, but you roll it through here, and we kind of do multiple passes so that we're making sure that we're treating the whole skin.
And this is one of those things also, like what we talked about before, several treatments or a few treatments,
Yes.
then you really see those,
Yeah,
those
this
fresh
is more
results.
transformative. Whereas you think of the clear and brilliant as a maintenance procedure, this is, hey, I'm revamping my skin.
All right.
And you have some downtime with this. Unlike some of the other procedures where you really don't have downtime, this you do have to take some time off from your social schedule.
So what kind of time are we talking?
You're about 4 days, then you're back to normal. So
Okay.
not terrible. A long weekend
Right.
for
Do it
most
on a
people.
Thursday,
Do
you're
it
ready on
Thursday,
Monday.
You're probably ready on Monday. With some makeup, you might still be a little pink. And most of the people will experience some discomfort with this. We of course make people comfortable. People have numbing cream on their face, and that makes it tolerable for most patients. They do great.
Well, let me ask you a question about how you decide which one you want to use on
Yeah.
a client. If somebody is just questioning this, what do you suggest? When they make that phone call to Wilmington Dermatology, what happens after that?
Then you can come in and have a consult with me, one of my physician's assistants, or my cosmetic coordinator, and we can kind of review your goals.
And how much do those cost?
Those are free. So
That's the best
great.
part.
That's the best part. They're free. You know, there's so many things, and people don't know what they need, and half the time they don't even know what's bothering them. And so
Right.
they can come in, we can work through what's bothering them together, and we can go over all the different options. We can come up with a payment plan option too. You know, there are things that are affordable, there are things that cost a little bit more money. There's really something for everybody.
And that's a good thing to address because
Yes.
these things sound outside the range of a
They
lot of
do.
people. So that's great to know that there are options
Yes.
for not only what you're doing to make yourself look
Yeah.
better, but also that being able to afford it.
Right, exactly.
When somebody comes in for that first appointment, you sit down with them, what are some of the questions you ask them?
The first thing is I give them a mirror and I say, what is bothering you? Because I want to know what's bothering them. And then I'll make suggestions. I go, I see that that's bothering you. And people will go in and they'll go, oh, well, I think that I need something here. And it's not what they really need.
Right.
So we try to guide them just based on our experience.
So not only comfort and making you calm with the equipment, but
Yeah.
hand-holding there in the very beginning
Exactly.
as well.
I mean, I want people to be comfortable spending their money and knowing that they're going to get good results. I'm very results driven. I want to deliver what the person needs.
That sounds great. I appreciate you showing me this so much.
Yeah.
It's been wonderful. I really
Thanks
do
for coming.
appreciate it. Thanks so much. Who knew it was that simple? The effects of aging can be reversed. Here at Wilmington Dermatology Center, they've got all the tools necessary to make you look your best. For your hometown, I'm Randy Aldridge.